I'm going to show you exactly what happens in your child's brain when they use a smartphone. I'm Dr. Johan D'Souza. I've been mentoring boys for 15 years and I have thousands of hours of clinical experience as a PhD level clinical psychologist. What I'm about to show you should terrify every parent watching this because by the time you notice the behavior problems, the grades dropping, the social withdrawal, the angry outbursts and tantrums, it's already too late. There's already been so many brain changes that have damaged your child. Stay with me for the next couple minutes because this may be the most important thing you watch regarding your child's development. Let me start with what changed. In 2010, something changed dramatically. This was unprecedented. It was only for young people. Depression, anxiety rates spiked, skyrocketed. ER visits for girls due to self-harm increased by 300%. Depressive episodes for girls doubled. Hospitalization for suicide attempts increased by 200%. This wasn't gradual. This was a cliff starting in 2010. You think that's coincidental? That was the year when the smartphone became popularized. That was the year when Instagram came out with the very first social media designed exclusively for the smartphone. Brain scans corroborate this. Studies of teens with screen addiction showed deteriorations in the brain similar to that of drug addicts, cocaine addicts. I'm not trying to be alarming. I just want to give you the facts so that you can make the best decision for your family. Let me show you what happens inside your child's brain when she picks up the smartphone. First thing to understand is that your child's brain is not just a smaller version of your brain. There are two major differences. One is the judgment center is not developed. So they don't have the self-control and inhibition that an adult brain, talking about mid-20s, early 30s is when it finishes developing, has. The second thing is that there are more dopamine receptors in the teen's brain. That's the reward center, the pleasure center. This wires them to seek novelty, seek stimuli. The smartphone rewards that. The smartphone hijacks the dopamine system using what's called a supernormal stimulus. A supernormal stimulus is something that gives you more dopamine, more pleasure than you would experience in normal human interaction in the natural world. Every time you get a notification, that releases a little burst. Every time you click on a video, it releases a little burst. Basically, every interaction with a smartphone, including just the color of the icons, just the shape of the icons, the haptics, the sounds that the buttons make when you press them, that releases pleasure. It's very attractive and they know exactly what they're doing because these are designed by literally thousands, maybe up to 100,000 behavioral psychologists. What's the problem with the constant dopamine release? Problem is that when the body experiences an above average and abnormal release of dopamine, it has to go to a balance. It has to go to homeostasis. The way it does this is by down regulating the dopamine receptors. What this means is the dopamine receptors actually shut down. So when you have that molecule in the brain bouncing around, it doesn't do anything until the receptor latches onto it. When the receptors shut down, that molecule is bouncing around, but it's not going anywhere. So we don't feel the same amount of pleasure. Maybe this is good when you're on the smartphone and you're not getting the same amount of addiction based on the stimuli for the smartphone. But what happens is now the volume is turned down for all the activities that we experience in day-to-day life. So the normal activities that we're designed to get pleasure from, we no longer find enjoyable. In other words, the tolerance has increased for the smartphone itself so that when we're on the smartphone, we need to use more of the smartphone or use it in more creative ways in order to just get the same levels of pleasure. That's called tolerance. Second major impact of smartphone on the brain. Remember we talked about the prefrontal cortex doesn't develop until you're 25 or even early 30s. It's responsible for impulse control, judgment, foresight, planning, emotional regulation. During the teenage years, it's actively under construction. You know how we develop the prefrontal cortex? By pursuing the activities that exercise it, by following the schedule, by practicing impulse control, by refraining from giving into distractions. Guess what? Smartphone interferes with all those activities. Smartphone is designed for immediate impulsive rewards and behaviors. When your child is scrolling, gaming, binge watching, there's immediate gratification. There's no frustration tolerance. This is actively weakening the development of the prefrontal cortex. This is what I see when I'm working with young people. The child's soul has atrophied. He's just a empty shell of his true potential. He relies on his mom to wake him up in the morning. Parents are constantly giving them reminders for homework and school assignments. My parents never gave me reminders, maybe because they're from a third world country, which I think was good for me. It forced me to be responsible. They give into tantrums, frustration. They're just acting like little kids. You ever notice how kids don't know how to look an adult in the eye and give a firm handshake? They don't know how to initiate conversation or small talk. In the critical years when the child's independence and self-confidence is supposed to be building, their soul is being sucked out through their eyes on the smartphone. Third major impact, chronic stress activation. Have you ever felt that you can't relax? You're not at ease. Your muscles are tense. Your thoughts are racing. You feel like a threat could be coming from anywhere. You continue to worry. That's called threat mode. That's what happens when we're constantly on, when we're never able to relax, when we're feeling a constant level of evaluation, comparison to others. That's what happens in social media, or the constant expectation that I could be receiving a message from someone that I need to respond to. This habitual impulse to check the phone, constant stimulation, fear of missing out. The body releases a stress hormone called cortisol. That's what happens when we have a consistent low level threat. And that's what's damaging to our physical and mental health. Why do you think anxiety has gone up? Kids can't concentrate and they're impulsive. The brain has triggered survival mode. The body's in an alarm state. It's very hard to focus quietly on one thing when your body feels like it's being chased by a saber-toothed tiger. Now I need to address the most important topic that no one wants to talk about. It's the elephant in the room. It's pornography addiction. If your child has a smartphone, he's almost certainly been exposed to it. One of the most representative studies found that 11 years old is the average age of exposure to pornography. I think it's even younger. That study was a couple years old now. And the Diocese of Arlington did their own private study, found that it to be as young as 6 years old, as crazy as that sounds. Pornography does something uniquely damaging to the brain. Remember that dopamine system we talked about? Well, nothing can match the dopamine that's released with pornography. Our bodies are wired for this. This is our deepest physical, biological instinct and drive, especially for young people, right? That's the age when the body's designed for procreation. Pornography floods the brain with dopamine at levels that make social media look tame. Learn what successful parents do differently. And if you're a school administrator or church organizer, reach out to me if you want to talk at your organization. Please subscribe, check out the guide, and I'll see you in the next video of the pornography crisis.